I am Dr.Srihari Modugala, a pediatrician neonatologist and a researcher in pediatric nutrition in the past 12 years. We have dedicated pediatric formulas and nutrition for the benefit of the child. Let's talk today on about the processed food. Many of the times when the mothers come to our OPD, their concern is that the baby is not been eating well, or it is having a problem in terms of passing stools every day. This has become a very common complaint in our OPD. At least 10 out of 50 babies which come to us have a very problem of constipation, starting from acute condition lasting to chronics of months together of constipation. Why is this sudden shift in constipation happening even in a preschool children? We had not seen this kind of constipation earlier, or this kind of problems which the mothers are facing in terms of constipation. Why is this happening? This is because there is a gradual shift of the food industry which has been processed. The foods, everything have been processed, so the way that is digested in our body is what is making the change. And especially when these processed food are not being supplemented with good amount of water, that leads to a mass which cannot be processed in our gut. Most of the mothers need to understand these processed food comes with a label where they have to be preserved for on the shelf. So they have a lot of other ingredients which are not compatible for the baby to digest, especially the biscuits or the maida. We don't know the content. A homemade cookie to a packed cookie, there is an enormous difference in the quality and the way it is preserved. So this makes the change how the child is going to process the food. A processed food, why are we talking in terms of only biscuits or any concern which is there on the shelf? The important note we have to do is that these processed food have to be already amalgamated with a lot of PFF2s or PF2 preservatives which can stop the enzymes within the gut. These enzymes, when are being stopped, will not digest the molecules the way the food has to be processed. Over a period when they are stretching, this happens to reduce the appetite of the child. When the appetite of the child is going down, automatically the food content or the fiber content which is required in the gut reduces. Eventually even the thirst factor also reduces, the water also reduces. So this helps in all mass which is formed, which is undigested and hard to throw out of the body. This over a period leads to a chronic constipation. Once the child is termed with packed with these feces, somewhere these specks of particles tend to stay there unless they are washed thoroughly. So this will be a repetitive intermittent episodes of constipation and diarrhea, constipation and diarrhea. So it is very important on a daily basis the mother chooses nutrition which will help to cleanse the gut, especially in terms of fruits, in terms of vegetables. So we don't have choice that we only have to get into feeding the babies with only these fruits or vegetables? No, the choice is what we take. A home based cookies or a home based any of your snacks can also help, because they have a regular based formula what we are making since centuries at home. So these will have the content which have been touched and processed from the hands. So there is a normal commensal bacteria which will happen, which will reach the gut and help in digestive enzymes. Over a period when there is a normal flora and which these flora help the digestion in the proximal gut. It is important that we have our home based and localized snacks and foods once in a while. These festive seasons and these celebrations, it is very important we choose our own home based foods rather than going for a processed and a packed food. And especially we see a lot of these patients and complaints coming back after these celebrations, because there is so much guarded with even the food which has been celebrated during the process are all being packed. So this will lead to a lot of difficulty in the child to digest. So it is the right time for us to choose that we make our decisions for our children. Thank you.